Hello and welcome to the Thursday edition of Video Clips. And first of all, just a couple of announcements. Monday, January 28th, our superstar Chef Del. And I can't tell you how fabulous this guy is and how fortunate we are to be in this building with Chef Del cooking for us every day, at least when he's in town. But anyway, he's going to share his special winter soups and stews recipes with you, and also take your questions about diet and health and food. And you know, Del is such a great person to ask about all these things because he's had his own struggles with weight loss and health improvement, and along the way has just been become an expert at making food delicious that is low fat or fat free and really good for you and fills you up and makes food a wonderful experience even when you're eating healthfully. Then the other thing is our resident master herbalist, Sabrina Seitz, will be doing a teleconference call on Tuesday, February 5th, 9 p.m. Eastern, also, on herbal remedies for cold and flu. Now, one of the things I like about Sabrina and why I like to have her as a guest on conference calls is that she is totally grounded in plant-based nutrition, using diet and exercise and lifestyle to maintain health, and as an adjunct to that, using remedies to relieve cold symptoms and that sort of thing. But she's not an holistic pharmacist. You guys have heard me talk a lot about people who use supplements and remedies instead of prescribing diet to fix what's wrong with your health. So I love her. She's based in our philosophy, but also knows a lot about herbal medicine. And she teaches for the Wellness Forum Institute. Okay, I have a couple of topics for today, and one of them is revisiting a couple of old topics, which are niacin and HDL levels. A recent study shows that when you use a combination product of niacin and a statin drug, you don't get better results. Don't reduce the risk of death from coronary artery disease. Don't reduce the risk of non-fatal heart attacks, strokes, coronary revascularizations as compared with statin treatment alone. So no benefit to the niacin. Now Merck did the study because they were planning to introduce a combination drug, and then they made an announcement that because the study did not have such great results, they're not going to apply to the FDA for approval. The combination product was approved by the European regulators in 2008, so much for the superiority of European regulations. Some people think they're much better. I have questions about that. Remember, these are the same people that approved chewable Lipitor for children a few years ago. So anyway, back to the matter at hand here. This isn't the first study using niacin that's failed, and one of the reasons why researchers keep trying is they will not let go of this idea that increased HDL levels don't translate to better health outcomes. And so studies have shown that niacin, along with several failed drugs, will increase HDL, but the studies also show that increased HDL doesn't result in improved health outcomes. So according to Steve Kopecky, physician with the Mayo Clinic, I'm going to read this quote because I love this guy. Now, we always thought that was causative, that HDL going up caused the lower cardiovascular events, but I think it's more appropriate to say it's how the HDL went up that lowered cardiovascular events. He further stated that studies have shown that improved diet, exercise, losing weight, smoking cessation, and low alcohol intake are effective strategies for lowering risks. So finally, we have a traditional doctor and a traditional institution saying all ways of manipulating biomarkers are not the same. Been talking about that for a long time. Lots of ways you can change your biomarkers. You can take drugs, supplements, all kinds of things. But when this happens, patients develop a false sense of security. Their blood tests are better. Sometimes they feel better, but they're actually getting worse. And you end up with this phenomenon I've talked about for years, people dying with good blood work. Think about Tim Russer from the news program that we used to love on Sunday morning. The right diet, however, will accomplish those changes in biomarkers and also improve overall health and better outcomes. So, second topic is concerning cancer treatment. And a couple of reasons I wanted to talk about this. First of all, because I read a great article written by Dr. Ralph Moss, and I remain a great fan of his. I wanted to share with you some of what he said. And the other reason is recently I've had to talk to an awful lot of people dealing with cancer and help them make decisions about what to do. One of the reasons I like Dr. Moss, by the way, if you haven't heard me talk about him before, is that he avoids extreme positions. In other words, I think part of the problem in cancer treatment is you have people over here saying, you know, traditional therapy, everybody should get chemotherapy, radiation, lots of surgery. And you have people over here that say you shouldn't ever do any of that. I don't think either of those stances are right. right. There are some valuable things going on in cancer treatment, but Dr. Moss is not shy about asking the tough questions that should be asked about how can we justify some of the treatments out there. They're expensive and many of them harmful. So in a recent article in the Townsend Letter, Moss discusses the trend of using progression-free survival, I'm going to refer to that as PFS, instead of overall survival in determining efficacy of cancer drugs. Now, this is very important. A drug can increase progression-free survival, but not help you live any longer. In other words, there may be a longer time before the cancer starts growing again, but if you don't end up living longer in the end, you got to ask yourself, is this really beneficial? Now, it's a recent phenomenon that the drug companies have started using PFS as their marker for the success of a drug. Moss reports that an analysis of randomized controlled trials of breast and colon cancer treatment concluded prior to 1984 showed that none of them used PFS as an endpoint. But an analysis of recent studies showed that between 23 and 29% of the randomized controlled trials that resulted in new drug approvals did use PFS. Now, Moss states, and I totally agree with him on this, that the efficacy of cancer treatment should be defined as either extending life or improving quality of life. Now, it is possible for a drug that increases the length of time before the cancer starts progressing again can improve quality of life, but that is assumed often without evidence. And there are many times when drugs that are effective at increasing progression-free survival time cause changes in the cancer cells which make the cancer come back with a vengeance, literally, and the patient actually loses on overall survival time. Well, when you combine this with the cost, because some of these drugs cost $10,000 a month or more, it becomes really difficult to justify the use of these drugs. And I don't think that patients are made aware of this information in clear terms so they can make really good decisions. Moss is an excellent writer, by the way. He's written, 15 books. I think I've read them all now. And he closes his article with something he calls the McNamara fallacy, named after a former defense secretary who measured progress in the Vietnam War by counting dead bodies. Think about that for a minute, how ludicrous that is. And this is what is called the McNamara fallacy. First, measure whatever can easily be measured. Second, disregard that which cannot be measured easily. Third, presume that that which cannot be measured easily is not important. And finally, presume that which cannot be measured easily does not exist. And the medical profession basically measures progression-free survival because it's easy, while failing to pay attention to and ignoring what's really important, which is overall survival. So the issue here is that many treatments offer the illusion of improvement, but not really any improvement at all. And boy, you sure want to know about that before you spend a fortune and expose yourself to the risks associated with some of these treatments. All right, that's all for now, and I'll be back to you next week. As always, pass this on to anybody who you think would benefit from seeing it. Have a great day and a great weekend.